Want to know how to get more therapy after your stroke? Well, in this video, I'm going to be sharing with you 3 ways to get more therapy after your stroke. I'm frequently asked by my patients how to get more therapy during the discharge process. The past few years, insurance authorization for therapy visits has significantly declined. This has led to an increasing number of stroke survivors going without therapy or with less therapy throughout the year. The first thing you should do if you're currently in therapy is to appeal the decision to discharge you. This decision is either coming from your therapist thinking you've reached your maximum level of function, and if that's the case, I highly advise you to find a new therapist who specializes in neurorehabilitation. But most likely it's coming from the agency or insurance basically saying that you are no longer covered for additional visits. If that's the case, then you should be sent a letter or a notice of your lack of insurance authorization, and on that letter or notice there should be steps to follow where you can appeal their decision to discharge you. Basically what happens if you do the appeal is it'll go to a third party who will review your case, and they'll kind of make the determination on if you would benefit from additional visits or not. But in my experience, most of the time we get typically 2 or 3, and in some rare cases 5 to 6 more visits. However, if you are not in therapy and are looking to start it back up, then you have a couple of options. The easy way is to ask your doctor for an order for therapy. Sometimes it's referred to as a script, but any doctor, nurse practitioner, and some states physician's assistants can write orders for therapy. If you are homebound, they will send out home health to you. If not, they will write you an order for an outpatient facility. You should be able to request where you go for your therapy. So it would be a good idea for you to do some research on some of the options available to you in your community, as you really want to find a neurorehabilitative therapist to work with, because they're going to provide you with the best quality of care and you'll be getting the best outcomes with them. Once you've figured out where you would like to go to continue your therapy, get a fax number of the facility or the agency. That way you can provide your doctor with the name of the location you want to go, as well as their fax number, so that they can fax everything over to the facility or agency, and you can get started with therapy as soon as possible. While you're at your doctor's office, you can watch this video here to ask them 10 specific questions about your stroke recovery that's going to help further your recovery process. The third and final way to get therapy after a stroke is through what's called direct access. This option lets you go directly to the therapist or facility without requiring a doctor's order to get started. So if you find a specific place you want to go, you can give them a call and see if they have direct access to you, and that way you can get therapy started. This option is available in most states. However, most states there are limitations to how many visits or how long you can be seen without the direct supervision from your doctor. In my state, it's 6 weeks or 42 days that you can be seen by therapy without requiring the oversight of a doctor. What's nice about direct access is it makes it really easy for you to shop around and choose the outpatient facility, home health agency, or independent contractor to work with. Again, I can't stress the importance on choosing the right therapist, because you can get the same amount of visits with 2 completely different therapists and get 2 completely different results. So it's important to do your research and find a therapist that specializes in neurorehabilitation to get the best possible chance at recovery. One other thing I forgot to mention is that if you've recently been discharged from therapy, you will likely have to wait 2 to 3 months. Really, it's dependent on your insurance provider before they will authorize additional therapy. But just know that you may have to wait a little bit if you've recently been discharged. And that's just the unfortunate reality of stroke recovery. It's a very long process, and insurance isn't going to pay for your therapy the whole time. So you're going to have periods with therapy and periods without therapy. So it's really important that you see someone who specializes in stroke recovery, and that you get a specialized home exercise program to continue your exercise and your therapy on your own at home, and make those small gains so that when you do come back to therapy, you can start at a more advanced state than you were before. If you like this video, the best free thing you can do is give me a like and a comment down below telling me a bit about your stroke and your experience in therapy. Did you work with a stroke specialist, or were you working with just a general practitioner? And what was your experience working with them? Also consider subscribing if you're interested in more videos on stroke recovery or on guided exercise videos, as we will be continuing to post videos like this one to help you make full recoveries at home. Thank you guys so much for watching, and have a wonderful day.